The next speaker would be Dr. Benjamin Ye, and some of you might already heard the closing speech of Dr. Benjamin Ye in the closing ceremony. And the topic is challenges and opportunities of young radiologists in United States. And as you might know that Dr. Ye is Asian people who is living in the United States, and in previous talk there is some cross-culture discussion about that. For example, those glass ceiling or something, and I think this kind of observation is very important, especially for those who are we are still staying in Asia, and that kind of difference might be helpful. Let's welcome Dr. Ye.
Thank you, Dr. Tsai, as well as again Dr. Zui Hong for having me here. There really is a culture difference. I now understand in America, the radiologists are looked upon actually as a lifestyle specialty. There's a joke, and when you pick a medical specialty, there's a road to happiness. You can pick a specialty in medicine that will increase the chances that you and your family can have a happy life. And the very first specialty in the road is radiology, also ophthalmology, anesthesiology, dermatology. These are respected specialties where there's a very good balance of income and lifestyle. And this is how it's perceived. I just want to show you that I looked this up. I hadn't seen this before. I looked this up last week. This is the salary of physicians. And you can see on the road to happiness, the best road is radiology. It has the highest average salary. Of course, this is in private practice. The academic radiologists make a little bit less. And I want to just show you other specialties. Certainly there are other specialties that earn much more. Neurosurgery, orthopedics, but radiology does very well. This is an opposite of China, but also creates many problems for radiology. The cardiologists always want a piece of radiology. They want the ultrasound, they want the CT, coronary arteries, CT of the heart. Gastroenterology would like to eliminate CT colonography, very resistant to referral to radiology. Orthopedics, they read their own MRI scans, read their own CT. They take the high reimbursement, the high paying studies, and try to bring them into their own specialty. So there will always be a turf war with radiology and the other specialties. In America, we have these acronyms. Can you guess what they are? There are 67 of them. What are these? These are the radiology societies in America. Not all of them, many of them. It's a very active group. So when I heard Taiwan has 4, we have more than 67. We can look these up very easily on this website. And for any particular area, there's probably 4 or 6 subspecialty groups that you can join. For example, abdominal imaging, neuroradiology, interventional, many groups. Another thing about radiology is, of course, the modalities keep changing. These are examples of cross-sectional imaging modalities that I was not trained to read, but that I now read. The 25% of what I do, I never learned in residency when I graduated 7 years ago. So CT urography, cholangiography, PET, perfusion imaging, MR urography, CT colonography, the list goes on. We keep changing, we keep evolving. You've heard about the American healthcare crisis. It's true. Yesterday, the US government signed a healthcare reform. Because of this problem, our GDP makes up more than 19%, or 19% of our GDP is spent just to take care of the US population. And the number one cause of the cost is imaging, radiology, MRI scans, cardiography. And because of this, with the reform, there will be changes. the amount of payment per exam will decrease, so our salary will decrease. Also, the amount of work per radiologist will increase. Still much less work per radiologist than in most of the Asian countries. And also the amount of time that we have for research and administration will go down. So the lifestyle that a radiologist enjoys has already changed quite a bit in 10 years. I'd like to pose another challenge to radiology. This is our #1 organization, the Radiological Society of North America. It gives out a tremendous amount of funding for medical students, trainees, assistant professors, and also other radiologists, $1.8 million per year. Compare that to another group in America, American Heart Association, cardiologists. They will fund undergraduates and all